In this video, I'm going to try to talk about sort of global considerations for hair restoration for the male patient. So the thing is, we need to look at a few items. One is there is a component which is medically treated and the component that is surgically treated. The medical component is managing patients with ongoing thinning. So essentially, you need to think about that we go from thick terminal hairs to thin vellus hairs to no hairs or baldness. So in that process of ongoing thinning, we need to slow that down and reverse a component of it. If we just do surgery for it and you continue to lose hair, we're going to have to keep on transplanting you. And the problem with that is we're going to eventually run out of donor hair. So medical therapy is, to me, very, very important for male pattern baldness. When you look at the spectrum of youth to aging, the younger you are, the more focused I'm going to be on medical therapy. For example, if you're 60-some years old with a relatively stable hair loss pattern, I may be just saying, okay, let's do surgery. If you're in the middle age bracket of 30, 40, 50, it probably is going to be a combination of both surgery and medicine to slow down the progression, reverse some of what you've got, and manage future issues. If you're young, let's say your teenage 20s, you probably should not do surgery because you may run out of hair. I may do a great transplant for you, and a few years later, I have to do another transplant for you, and then all of a sudden you don't have enough hairs for me to do the transplant. You've got this unnatural result that becomes a problem for you long term, and people don't think about it. In fact, recently I had a 20-some-year-old gentleman that said, look, I saved enough for Dr. Lamb to do a hair transplant for me. I don't have enough money for the medicine. And that's exactly false thinking, because that person is going to do this transplant. A few years later, he's going to do another transplant, no more hair left, all the hair has progressed, he's got this weird frontal transplant that doesn't look right. So medical therapy can be oftentimes a very important element to treating hair loss. Now, how do I make some decisions about it? As I said, first of all, I have to make sure you're safe to have surgery. But medical therapy is really good if you are thinning. So if those hairs are starting to get wispy, get see-through, then medical therapy, to me, is the way to manage what's going on with you. The surgical is to manage areas that are just frankly bald. There's no hair there, or very, very little hair, like you've lost a frontal frame of the hair. Or if your crown, if you're old enough to do a crown, I encourage you to watch that video, and you've got a bald spot back there, the medicine's not going to do very much. But if you're thinning out, just starting to get thinner, that is what medicine does. Surgery may not be the best option for that, and medicine really should be the best option. So let's briefly talk about medical therapy for hair loss in 2020 when I'm filming this video. And hopefully this video will be valid for many years. So medical therapy for hair loss incorporates many elements. Today, a lot of men are very frightened to use oral finasteride or Propecia based on some of the reported issues online about long-term sexual side effects and things like that. But I still believe that finasteride is a gold standard of therapy. For me, topical finasteride has really, really worked well for my patients, because the topical finasteride allows the men to have very, very low risk of side effect profiles, and in combination with minoxidil, the therapy can be very effective. Now, in some men, the oral finasteride still is better. Some men, both together. In some men, the topical therapy is sufficient. The good news is the vast majority of men, topical finasteride works extremely well for my patients. The caveat is if your wife, if you're married, is pregnant or becomes pregnant, you want to be really careful, because with the topical therapy, if the wife licks your wet scalp or ingests the product, there's a risk of what's called a hypospadia, or a birth defect in the male fetus, but really not something to worry about if the male is taking it in terms of the semen and things like that. So that starts taking effect over a few months, and you start getting progressively better. The other therapies that are out there that work well are Nutrafol, which is basically a therapy to help with hair loss through a supplementation. Low-level laser therapy. The lasers out there, unfortunately, for the most part, don't work very well because they don't have enough true laser diodes. The laser that I have works really, really well in terms of helping my male patients. And those are sort of the major things. Some natural DHT blocking shampoos can add a little bit more to the equation. But the principle today is still a finasteride minoxidil combination in terms of medical therapy. With medical therapy, sometimes you can see a little shedding before the improvement. So not to be worried about that if you see that. It's not necessarily a bad sign. So medical therapy to me goes hand in hand with surgery. Together they work so much better, and most of my patients. You're going to hear me say that during a consultation, but I want you to hear this in this virtual consultation so you know my philosophy. In terms of PRP, in terms of exosome injections, there are a lot of these people that are thinking that these injectables will be a nice adjunct as well. So far, I have not been impressed with the results with these therapies. I used to do PRP injections as a standalone procedure, but today I don't do that because I don't believe that there's a huge level of efficacy and consistency with that. So that's medical therapy in a nutshell. Let's talk a little bit about the surgery. So there are two major methods of doing surgery. There's FUE, follicular unit excision, and FUT, follicular unit transplant, also known as single strip elliptical excision or an incision. A lot of people out there think, oh, the FUE is the only way to go. Anything else is a dinosaur, and that's actually very, very false. I do a lot of both FUT and FUE, so in a lot of those other videos I talk more about when I use one or use the other. To me, it's a spectrum, and unfortunately today, a lot of doctors don't know how to do FUT, so they think it's, you're gonna have some ugly scar and they sell you that. I can tell you I've seen so many bad FUE results where people's backside is completely depleted and over-harvested, and that's far worse than a linear donor scar in my opinion. It's not even fixable, whereas a linear donor scar, I can usually fix that. So let's talk about the candidacy of FUE versus FUT. When do I as a surgeon think, FUE is the best option for this patient? And when do I think, FUT is the best option for this patient? And then when do I think there's a gray zone where I can say, you're a candidate for both? Let's talk about some pros and cons for both. So I'm going to talk in generalities because clearly I'm not seeing you as an individual patient, but I think it's worth to go through these concepts. So FUE is obviously a sexy product because there's no incision, but it's not scarless. So a lot of people think, hey, I'm not gonna have a scar. No, you're gonna have scars. In fact, the total number of scars is actually exceeding FUT in terms of the little dots, because you can have hypopigmentation. You will have hypopigmentation. If you shave your head, there are visible scars. So a lot of marketing hype out there that says it's scarless is absolutely false. Neither procedure is scarless. But the FUE, the major benefit of it is you can shave down your head a little closer and potentially not see a linear incision. So that's clearly a huge benefit for FUE. The problem with FUE is several-fold. One is safe donor area. So what that means, the areas that are genetically programmed for loss, as it starts to come down the backside, if you have a big open crown, if it starts to come down, I have a very limited number of grafts that I can use for FUE. And after a few sessions of FUE, sometimes only after a couple of sessions, I may not even have enough transplants to do further transplants for you with FUE. So I have to look at the backside. Again, if your backside is a big, high wall of usable hair, FUE is oftentimes very, very good option. But if it's starting to come down, or the crown is starting to open up, it provides two issues. One is when it's starting to come down, the total, so actually let's hold that off. I'm going to say that in a minute. The safe donor area becomes encroached on, which means now it's starting to take those grafts and not be usable in the future, because if I transplant way up here, I take this graft and move it up to the front with FUE, and that hair loss starts to regress. Now you've got visible scars, you've got lost grafts, and that can be really problematic. So part of this predictive capacity of who's a safe candidate for FUE versus FUT is something that I have to talk to you about and really go through with you in detail so that I can see if you're a good candidate. For FUE and FUT, the other thing that's really a huge component of this is the total donor capacity. I briefly mentioned about this. But with FUE, because I have to harvest over such a wide area, the problem with that is that I can deplete the donor a little bit faster. And of course, if you've got great donor density, that usually is not an issue for multiple sessions. And you can also deplete the donor area with an FUT. I'm going to go specifically more detail of how I look at these things. But if you like to wear your hair short and you've got limited hair loss, more sort of frontal zone, FUE is oftentimes the best option for you. If someone is seriously bald from front to back and they've got a huge crown zone, because of the safe donor area issues I've talked about and the total donor capacity, I discourage FUE because I'm going to encroach on the unsafe donor area and I don't have enough hairs to do the work. So unless you say, look, I just want the front done, I can still oftentimes do FUE, but then you still have that question of whether you're encroaching on the safe donor area. So for me, this complex judgment comes into play, and it's almost instantaneous. When I start looking at a patient, I can immediately say, you're a good FUE candidate, you're a good FUT candidate. Where that bridge between the two is the person has moderate loss, relatively high fringe, wants to potentially wear their hair shorter. Those are those gray zones when I'm deciding between FUE and FUT. I hope this video hasn't confused you, but this is the complexity of when I start thinking about judgment. And because I perform the full gamut of both procedures, I really like to have that dialogue with you. And if you said, Dr. Lamb, whatever it is, I've heard all the marketing hype, I don't want an incision, don't do that for me. Fine, I don't have to do it. But then what I have to do is give you ethical hair restoration where I give you something that's safe, that's 5 or 10 years from now. Something that I can predict as best as I can coming up in the future, what I can do to minimize risk for you on the long end. And those are the kind of discussion points that I have to talk to you about, because unfortunately a lot of places out there, salesperson sells you this, they don't care, all they do is FUE, and they want to do that for you. So this is a very long consultation just to give you those concepts of how the decision process is for both of those. Let's talk a little bit about the experience and the recovery and the results when you have a procedure. I'm going to talk in this video about both FUE and FUT recovery, as well as the experience, etc. So the great thing with the procedure is we do things, because we're a Joint Commission accredited facility, we can give you a little bit of sedation, a little bit of pain, IV intravenous pain anesthesia. So unlike other places where you feel the full weight of time, where it feels such a long day and the discomfort of the injection, we simply don't have those issues here. The patients feel much more comfortable. We have everything as far as we can in terms of safety provided for you, in terms of making sure you're safe during the procedure, hemodynamic monitoring, everything, cardiovascular monitoring during the entire procedure. So safety, comfort, reduction of anxiety is a huge thing. Now with FUT or strip procedure, you're a little bit deeper. It's almost like you've had a few cocktails. It's level 2 conscious sedation. So people always ask, what kind of anesthesia is that? So there are 4 levels of anesthesia. There is level 1, which is just an oral pill. That's what most people do. To me, that's not enough because it provides still a lot of anxiety, discomfort, and the weight of the day you feel. Level 2 is what we provide, where you're going to feel pretty groggy, you feel a little sedated, you barely can feel any discomfort during the procedure, and you don't feel the weight of time. Level 3 is twilight, where you're really, really deep. And level 4 is general anesthesia. I actually can offer all 4, and I do provide all 4 levels of anesthesia here. But for hair restoration, you don't need the deep anesthesia. It's only for the first few minutes during the anesthetic during the procedure that I give you the anesthesia. So for FUT, slightly deeper, you're sort of knocked out a little bit more, and I harvest, I close everything, I do the recipient sites, and at the end of that point, we're going to sit you up, and you're going to have lunch. In the afternoon, my staff are placing. With FUE, I do give you ongoing little bit more anesthesia because the harvesting takes longer. And so during the harvest, I may ask, how are you doing? You say, I'm a little more awake than I would like. My nurse comes in and gives you a little bit more comfort, so just to make that better, because it's a longer harvesting period of time. But I have to keep you not as deep as the FUT. It's just a little bit lighter, but I want to keep you steady throughout that period of time because of the longer harvesting time. So because you're lying flat down this way. So you're going to be a little lighter, but it's going to be maintained longer than FUT. Basically, by the end of that morning portion, again, you're going to have lunch, and then my staff are going to be placing the grafts by the afternoon. The big thing to understand is that I've got incredible staff in terms of the level of quality control when they place grafts. Hair curl, the insertion, the lack of traumatic insertion, how the grafts are placed are just second to none, and it's just a huge component to the whole thing. By the end of the procedure, when you're done with the day, at this point, you can go home, but you're not able to drive, so you're going to have someone take you home. So you have to have a ride. You can't take an Uber. You cannot just go home. We need to have someone pick you up and take you home. At the end of the day, you go home, and then we'll review some instructions with you. The next morning, I'm going to see you. Whether it's FUE or FUT, I'm going to see you the next morning. Just make sure the grafts are intact, review all the instructions with you. You're going to get a formal time where you're going to have a pre-op time where you're going to meet with my staff and go through all of the instructions in great detail and meet with me again pre-operatively. So this is not to be a replacement for that. It's just sort of a general overview. It's things that I talk about during my consultation, but it's great to hear this several times. So the recovery, people always ask, what is the recovery like? So From FUE, you're going to have the backside exposed. You're going to see little dots, little scabs, but by a week, that area is pretty much covered. With FUT, you're going to have hair covering over the area, so you shouldn't even see the incision lines, pretty well camouflaged. And those little stitches come out about 2 to 3 weeks after the procedure, pretty painlessly. In terms of pain, bruising, swelling, etc. Pain-wise, a lot of people read, oh, FUT is so much more painful. It really isn't in my hands. I had a lady this morning, I did yesterday, they had some discomfort, which is incredibly unusual, but I knew how to manage it. That was just some nerve irritation. I put 2 drops of Botox in, boom, pain is gone within 1 minute. So discomfort level with FUE, FUT, very comparable. There's not a lot of discomfort with either one, although you could have a little bit more with the FUT, but typically it's not bad. In terms of swelling, only about 15% of my patients have bizarre swelling around their eyes. That typically only lasts about 3 to 5 days, occasionally up to 7 days. I've had one patient 8 days, but again, 85% of my patients don't have a lot of swelling. Wearing sunglasses will cover that up. And the biggest issue in terms of recovery is you're going to have visible scabs. If you're totally bald and you can't cover the scabs, you've got to wear a hat. You can wear a hat with, pretty much when you leave. With some exceptions, which I don't want to get into because it's going to make this more complicated. But you can wear a cap to cover up the scabs, and the scabs develop over a few days to a week. And that's the biggest limitation when you're looking at something that may make you not be able to go in public. But again, a hat would cover that. And at 7 days, you can rub all the scabs away. In terms of the way that you feel, most patients feel pretty comfortable. I don't think they really can't go to work, but if you have that swelling for a few days or you have the scabs that you can't cover, clearly that's going to be compromising in terms of your social professional interactions. After 7 days, when the scabs are gone, for FUE, when the backside is grown in a little bit, where it's covering the backside, most patients are pretty good at 7 days. But if you have a high-profile job, I can't promise you someone doesn't see a little discoloration or a few grafts in that area. But most people have about a 7-day recovery time. You can shower after 24 hours for either procedure, light shower pressure. And what you're going to be doing is doing an ATP spray. That really helps the grafts grow. It's like CPR for the grafts. The next question people will ask me is, when can I go back to working out? What kind of physical activity restraints will I have? So from exercise perspective, I'm okay after 10 days for you to 10 days for you to start listening to your body and start going back to a light workout regimen, but not to be pushing it too hard, because you may fall down, faint, and all those things. If you put a lot of pressure in, you may just feel exhausted. You may, fall, whatever it is. I want you to listen to your body. Slowly go back to that. Some of the restrictions, if I'm doing an FUT procedure, 6 weeks, no swimming, no dirty water exposure in terms of tub bathing, going underwater, or all that. If it's an FUE procedure, 3 weeks, you can go back into the swimming pool, do those kind of things. 3 to 4 weeks roughly. So there's maybe a 2 to 3 week difference between the two in terms of allowing you to go into dirty water exposure. In terms of traumatic sports like this, I would say probably 6 weeks for the FUE and probably 3 months for FUT in terms of karate and things like that. Just working out though, just listen to your body. Usually most of my patients start going back within a week or so after that. The next question people ask me is, when do these hairs grow in? Because we use PRP, ACell, ATP, hyperthermosol, again, one clarification is that I use PRP with the surgery, not as a standalone by itself. I don't think PRP can grow hair well enough, but I think that PRP with all these other technologies really help grafts survive so much better, whether it's FUE or FUT. I've seen as early as 4 months growth, but most times it's starting to look good about 5 to 8 months. So it's a much faster window and much higher percentage of survival rate than other places. Partly it's due to obviously the technique of what we use, but also because of the regenerative medicines. So over time, that graft starts to become better and better, and over a period of 6 to 18 months, there's full expression of it. What are some limitations of surgery? Well, the biggest limitation I tell my patients is, I believe that if you look closely, you may always think, Dr. Lamb, could I have like a few more grafts here, here, here? And I always tell my patients there's always a chance you may need to have more grafts. But I'm very confident, and by using all these technologies that I do and the type of surgery that I do, that my patients get really consistent good growth. So the key with this video is talking specifically about the experience, the nature of the recovery and the results and the timing of the results. So I hope this video helps you out.